Thank you for watching the video. This is YouTube Medical University. This time, it's about vitamin D. Actually, recent studies show that about 98% of Japanese people are deficient in vitamin D. There is a report, vitamin D is necessary to strengthen bones. Vitamin D, many people are aware of vitamin C, but may not realize how important vitamin D is. However, vitamin D is not just for strengthening bones. It's not only about maintaining muscle strength or improving mental state, but also reducing the risk of falling and even affecting immunity. Various effects are expected, and it's considered important among doctors. If you were asked which vitamin is the most important, many doctors would answer vitamin D. In fact, vitamin D can be prescribed as a medical drug in hospitals. In this episode, we will discuss the vitamin that Japanese people often lack, what changes occur in the body when it starts to become deficient, what kind of food should be consumed to supplement it efficiently, and recommended products. And what about supplements? I would like to explain about such things in this way. At YouTube Medical University, we broadcast knowledge that can be used from tomorrow, easily understood from the standpoint of doctors who actually prescribe osteoporosis and vitamin D drugs. We would be very happy if you could subscribe to the channel so that you don't miss new videos. In this episode, firstly, what is vitamin D? A nutrient that can be produced in the body by a certain method even if you don't consume food. Secondly, I will introduce the changes in the body that occur when vitamin D is deficient. Thirdly, I will talk about the specific numbers of how much of vitamin D supplements, which I actually take, should be consumed. And finally, I will introduce recommended foods for efficient intake of vitamin D. By watching this video to the end, you can deepen your understanding of vitamin D and prevent future health damage. I believe it can reduce your risk. Please listen to the end. So, in the first part, what kind of nutrient is vitamin D? The main function of vitamin D is to absorb calcium taken orally. It's the source of our bones. It has the function of making it easier to absorb. In short, it strengthens the bones. Not only can it be taken orally, but it can also be produced from the body just by basking in the sunlight. Just by exposing your skin to ultraviolet rays, you can actually produce vitamin D. However, the number of people working at desks has increased and they can't get direct sunlight, or they apply sunscreen to protect their bodies from ultraviolet rays. So in reality, they can't produce enough vitamin D from sunlight, as I mentioned earlier. The rate of vitamin D deficiency among Japanese people is as high as 98%. Even if you get light through a window, it's not good, and even if you apply sunscreen, you can't produce vitamin D, so you really need to get direct sunlight. You need to produce 400 units of vitamin D, which is 10 micrograms per day, from sunlight. In Okinawa, where sunlight is strong, being outside for 5-7 minutes daily in summer is sufficient. However, in Tokyo, especially when sunlight is weak, you need about 10 minutes outside. In Hokkaido and northern Japan, you need about 15 minutes in the summer and even more in the winter to expose. In the Kanto region and Tokyo, you need 30 to 40 minutes. In Hokkaido, it takes even longer. In winter, if you're not outside for more than an hour, you can't produce 10 micrograms of vitamin D from ultraviolet rays. Spending over an hour outdoors daily absorbing sunlight is common. The 10 micrograms mentioned, equivalent to 0.3 ounces, is the suggested daily vitamin D intake for Japanese individuals, not an excessive quantity. However, overexposure to ultraviolet rays increases the risk of skin cancer. Many people avoid sunburns for beauty reasons. If you don't get much sunlight, be mindful of getting it from your diet. And then, there are mainly two types of vitamin D. These are known as vitamin D2 and vitamin D3. Simply put, vitamin D2 is a plant-based vitamin D found in vegetables and mushrooms, while vitamin D3 is an animal-based vitamin D found in meat and fish. The vitamin D that is produced from our skin when exposed to sunlight is vitamin D3. As a point, it is said that the absorption efficiency is better for vitamin D3, which is animal-based, than for vitamin D2 when taking vitamins from food. I will explain in detail later, but it contains a lot of vitamin D. Be aware of meats and fish, especially fish, which are excellent. Considering the absorption rate, it is good to first consume fish. Please remember this. So, what kind of changes will occur in the body if there is a lack of vitamin D? It's not just that the bones become weak. You may have recently become prone to falling, catching a cold, or feeling tired. It's not impossible. These symptoms may also indicate a lack of vitamin D. Let's learn more about it. When there is a deficiency of vitamin D, it can cause Vitamin D deficiency in the body can increase the risk of developing certain cancers. Recent studies like the VITAL trial have shown that elderly people and others with vitamin D deficiency have a higher risk of colon and breast cancer. However, cancer is not the only health concern associated with vitamin D deficiency. Supplementing vitamin D in elderly people. Vitamin D reduces the risk of cancer-related death. The link between vitamin D and cancer is unsurprising. A single large-scale study isn't enough to definitively link cancer and vitamin D. More research is needed, but there's a possibility of a connection. Vitamin D deficiency can cause changes in the body. The second choice is a decrease in immunity. If you've been feeling unwell or prone to illness recently, this could be related to a vitamin D deficiency. A total of 37 trials involving approximately 45,000 people were conducted. In the study, it was a placebo suspicion between those who were taking vitamin D supplements and those who were taking a medicine that did not contain any nutrients. When compared with those who took the medicine, there was an acute respiratory infection, or in other words, a respiratory infection. It's a cold pneumonia, and the risk of developing such things is lower for those who are taking vitamin D. The results show that the group taking vitamin D had a significantly lower risk. The difference is only a few percent, but it was for those who were taking vitamin D. The study found that the vitamin D group had a lower risk of catching a cold. This large-scale trial adds to the growing evidence linking vitamin D deficiency to an increased susceptibility to colds and the associated bodily changes. The risk of diseases and cognitive disorders increases with the fifth choice. The blood concentration of vitamin D is low. In the group, we measure cognitive disorders using a test called Mini Mental State Examination. There are reports that the test scores were lower compared to those with normal vitamin D levels, but that's not all. In an analysis involving about 50,000 people from 41 trials, it was found that those with depression, when vitamin D was supplemented and a placebo was taken, reports suggest that vitamin D supplementation may alleviate depression symptoms compared to placebo. Vitamin D may not only prevent colds or fractures, but also relate to mental and cognitive functions. Changes in the body that occur when there is a deficiency of vitamin D. The fourth of the 5 changes is a decrease in muscle strength due to fractures and falls. As I mentioned earlier, vitamin D helps absorb calcium. Therefore, there are cases where vitamin D is prescribed for people with osteoporosis. In a certain observational study, it was reported that the risk of fractures increases when the concentration of vitamin D in the blood is low. It is also reported that taking calcium along with vitamin D reduces the risk of fractures at the base of the hip joint by about 13 to 19%. And that's not all. What's more, it is expected that it may also help prevent falls and muscle weakness, which are causes of fractures. In a certain study, it was reported that a low concentration of vitamin D in the blood was associated with muscle weakness in children and the elderly. There are reports of this. Furthermore, in a credible study that analyzed 29 studies, it was reported that supplementation with vitamin D improved muscle strength. From such things, there is a trend among people who have been doing muscle training recently to take vitamin D intensively. We talked about children's muscle strength earlier, but children are prone to vitamin D deficiency. And if children in their growth period are deficient in vitamin D, a disease called rickets occurs where calcium does not deposit in the bones, making the bones soft and deformed, resulting in bow legs or poor growth. Serious symptoms appear when children start walking, such as not being able to walk well. The Japanese Society of Pediatric Endocrinology defines that the risk of rickets in children increases in areas with little sunlight, such as the northern countries, for children who are completely breastfed and mothers themselves are deficient in vitamin D. From such things, vitamin D is an important nutrient throughout life, from children to the elderly. Falling and fracturing bones is said to have a mortality rate similar to that of cancer. Medical professionals are well aware of how falling and breaking a bone can disrupt a person's life. To live a full life in the latter half of life, to walk on your own feet, to eat what you like, to be able to travel, it is important to maintain muscle strength to reduce the risk of fractures. For that reason, I am telling you that vitamin D becomes more important as you age. Changes that occur in the body when there is a deficiency of vitamin D. 5 choices. Finally, the 5th one is this, a blood test. Something recently. I've been getting tired easily lately, and this could also be related to a lack of vitamin D. When we talk about anemia, there's an image that iron is important. I think that's generally the case. Actually, vitamin D is also important because it enhances the absorption of iron. Vitamin D not only promotes the absorption of calcium but also minerals like zinc and iron. So it's not just about calcium. If your blood doesn't improve, it could be that you're lacking vitamin D. That's something to consider. This is a review up to this point. If you're deficient in vitamin D, the first change you might notice is an increased risk of colon cancer or breast cancer. The second is a weakened immune system, making you more susceptible to colds and pneumonia. We've introduced the possibility that a lack of vitamin D can lead to these conditions. Thirdly, supplementing with vitamin D can improve symptoms of depression and potentially improve mini-mental state examination cognitive scores. Fourthly, we've discussed the risk of fractures and falls due to decreased muscle strength. Finally, we've mentioned that vitamin D can even affect the absorption of iron. This is something to consider. My symptoms may be related to this as I'm taking vitamin D. Share your thoughts in the comments if you have any insights, as it could help other viewers. Please subscribe to the channel if you found this even slightly educational, so you don't miss new videos. It would be encouraging. In the second half, I will explain how to supplement vitamin D, whether it's through supplements or food. If it's from food, what kind of food is recommended? I will explain in detail. Then, in the third part, I will introduce the vitamin D supplement that I actually take. I will share some important considerations about supplements. The term supplement means to supplement what is lacking, as the name suggests. Even if you take in more of what you already have enough of, it often becomes meaningless. It depends on your lifestyle. It's fundamental to consult with your doctor or nutritionist and take supplements for what you lack. Depending on what you take, overconsumption can have negative effects on your body. Please be careful. Please keep this in mind. If it's vitamin D, you can have a blood test at the hospital to determine if you're deficient. There's a test item called 25-hydroxyvitamin D in the blood, and if these are generally below 20 to 30, vitamin D deficiency is suspected. If you're concerned, I recommend you to visit a medical institution and get tested. That's what I wanted to talk about. In a study involving about 5,000 residents in Tokyo, 98 It is said that 98% of them had low vitamin D levels. Especially in areas with little sunlight or those who work without getting much daylight, I think many people have low vitamin D levels. Could you tell me what kind of supplementation methods are available, please?
Thank you for your contribution this time.
There are products available, but what I've been using is a vitamin D supplement from GNC. It also contains docosahexaenoic acid and icosapentaenoic acid. I've also been using GNC, docosahexaenoic acid and icosapentaenoic acid supplements, and there are two reasons for this. The first is that this supplement allows you to take in a lot of vitamin D with just one capsule. With one of these supplements, you can take in as much as 50 micrograms, which is equivalent to 2,000 units. That's quite a lot. Please take a look at the amount of vitamin D contained in other supplements. Compared to others, this one contains a lot of vitamin D, so you can get a lot of your daily vitamin D just by taking one capsule. That's why I chose this product. By the way, the daily upper limit for adults is around 1,000 micrograms or 4,000 units, so taking too many of these capsules could exceed that limit. There is a risk, so it's reassuring to aim for one capsule a day. Another reason I chose this product is because it's safe and secure. After all, it's something I put in my mouth, so I want to know what kind of process such a product is made with. This product has obtained a patent. The Swiss pharmaceutical company manufactures it exclusively in Switzerland or Germany. It has been granted a patent for its quality. It uses a high safety vitamin D, which is natural and has a high absorption rate. Vitamin D3 is used, so I think it makes sense, and it's included in the supplement. Even the capsule itself is well designed. It's allergen free and gluten free, so it's easy to recommend to various people, and recently such interesting products have been released. It's called Vitamin D Kids Balls. It's designed to be safe and easy for children to take. It helps to make breathing smoother. They are small white tablets that pop in your mouth. They're easy to try even for those who struggle with capsules or tablets because they're small and pop in your mouth. And this supplement is really... The scent of peach oil fills your mouth, so it feels like you're eating a small popping candy. It contains 400 international units of vitamin D per serving. The average daily intake of vitamin D for Japanese people is said to be around 8.5 micrograms, so one pill can cover the recommended intake. The volume is small, so it's easy to adjust so you don't overdose. I think it's a merit. For those who say that medicine-like things are hard to swallow, the capsules are large and hard to swallow, and for those who say that they have enough medicine from the hospital and don't want to increase it anymore, it says kids. But I recommend it for adults as well, so please give it a try. I live in Hokkaido myself, and the sunshine hours are short, and I basically work as a doctor, so the risk of vitamin D deficiency is very high, so I consciously take vitamin D. But supplements are often tablets or capsules, right? In that sense, these Gokuri vitamin D kits are small balls that melt and spread a peach scent so they can be taken casually, so I've been using them regularly. Details are listed in the summary and comment sections. I think it's easy to manage economically because if you have one, you can use it together from children to adults. In that case, without resorting to supplements, what kind of food should you be aware of when getting it from food? I will explain about that. Recommended food for taking vitamin D. First, let me state the conclusion from the 6 selections. First, dried shiitake mushrooms have 85 micrograms. Second, they have 17 micrograms. Salmon has 13 micrograms of vitamin D. Grilled eel has 38 micrograms. Sardines have 61 micrograms and 3.8 micrograms. How about this? Dried wood ear mushrooms and dried sardines are quite strong. Such items have lost their moisture, so you can efficiently intake vitamin D per 100 grams. And considering absorption efficiency, animal sources are recommended over plant sources. For instance, in shiitake mushrooms or salmon, there are as much as 38 micrograms per 100 grams. Compared to the daily recommended intake of 8.5 micrograms, it's quite excellent. You can see that just by eating once a day. It's not an exaggeration to say that you're getting enough vitamin D, and it's something you can easily get. Still, it's important to be aware of eggs. Prices have been rising recently, but still, I think eggs are cheap compared to other things. Just eating one gives you 3.8 micrograms. Just eating 2 gives you about 8 micrograms. This gets you close to the daily intake goal of 8.5, so I think it's very effective to consciously eat 1 a day to make up for a vitamin D deficiency. Another thing I personally recommend is to take vitamin D and calcium together. This can help prevent a decrease in muscle strength. There are studies that show this can prevent bone fractures, and so on. In that regard, dairy products like milk fortified with vitamin D and yogurt are available. It's important to take in a set of vitamin D and calcium, so such milk or yogurt can be easily obtained at convenience stores or supermarkets. So please give it a try. If there are any foods that you all eat, please share in the comments section. Also, Chiron eats mushrooms, fish and eggs every day. If you can't do that, remember to get some sunlight. Apply sunscreen not only on your face but also on your arms and other exposed areas. It's important to have the awareness to get a certain amount of ultraviolet rays to produce vitamin D from your skin. Even when the sun is out, it's not a bad idea to open the windows and get direct sunlight from inside your house. Please be aware of what you can do for yourself. This is a review so far. As a way to supplement vitamin D, we have introduced supplements like GNC's Vitamin D and Vitamin D Kids, and specific foods like dried shiitake mushrooms, sun-dried jack mackerel, and dried sardine eggs. Please consider supplementing with supplements where real food is not enough. It's been a long video, but thank you for watching until the end. I would be happy if you could review this video while taking notes or listening to it many times. There are many unknown effects of vitamin D. If you are worried, I would be happy if you could share this video and let them know. Whether it's a good button or a bad button, I would appreciate it if you could rate this video as a reference for the next video.